I'm Lynn, Dr. Berg's marketing director, and I just got back from a wonderful trip in Cabo. However, on my very last day, as I was leaving, I tripped off a stair and sprained my foot really badly. I knew to put ice on it, and when I got home, I texted Dr. Berg, and he said, well, I'll see you on Monday. And so this is a video of his examination of me. So Dr. Berg, what are you seeing on my foot?
Well, besides the swelling of your midfoot, your pain was localized along the third and fourth metatarsals at the point that it joins the midfoot. And we call that combined sum total of where all those bones join at the midfoot, Lisfranc's joint. Because people do have a twist and sprain, like you did, that torques the foot. Instead of spraining the ankle, you can see that that whole section can be sprained. And what we worry about are tearing of the tissues, called the ligaments, that join those bones, and producing instability, in which case we would see, possibly see, that instability by a partial to complete dislocation of one of the joints. And the next thing, which we're concerned about, of course, is any degree of fracture. And your pain was localized here and here, primarily. So what we do for this injury, given that your foot has normal alignment and the bones show normal alignment at the midfoot level, is treated as a sprain of the midfoot, Lisfranc's injury, without fracture, which is really the same treatment as we would if it did have a small fracture without displacement, and that would be immobilization. Immobilizing things means making them still enough to heal. And it doesn't mean that just because you go in a boot, a cast, or anything, that it's enough. So sometimes it takes a boot up to the knee, and if pain isn't reducing, then crutches are added, which is what I would advise for the moment. Then we give it 2 or 3 weeks and see where it's at. And if you're improving, then we make a decision about whether to do physical therapy or graduate back toward your shoes.
So I'm relieved at the diagnosis that there's no break. Instead, I have to wear a boot, which is okay, and I can live with that. And I'm just glad it's not July and really sunny out. Here's the lovely boot that I have to wear until Dr. Berg says it's okay to stop wearing it.